Hey there, amazing people. Dr. Anna Schneider here, your friendly neighborhood doctor with over 15 years of experience helping folks take charge of their health. Let me ask you something right off the bat. Did you know that nearly 1 in 3 men over 40 deal with erectile dysfunction at some point? Yep, you heard that right, 30% of guys. So, why aren't we talking about this more? And more importantly, what's really causing it? Stick with me, because today we're diving deep into what's behind erectile dysfunction, or ED, and how you can turn things around. This isn't just about science, it's about reclaiming your power, your confidence, and your life. Ready to feel unstoppable again? Let's do this. As a doctor, I've seen it all, men of every age walking into my office, heads down, feeling like ED is some kind of personal failure. But here's the truth I want you to hear loud and clear: ED isn't your fault. It's a signal from your body, not a life sentence. And the best part? It's fixable, often without popping a single pill. Today, I'm breaking down the top causes of ED, backed by science, and giving you practical, no-nonsense solutions to get back in the driver's seat. So, grab a coffee, or maybe a green tea, we'll talk about why later, and let's get started. Oh, and drop a comment below. Where are you watching from? New York? London? Hanoi? I'd love to know. First things first, let's get on the same page. Erectile dysfunction is when a man struggles to get or keep an erection firm enough for sex. It's not just a one-off oops moment, it's when it happens consistently. Now, here's a stat to blow your mind. According to the National Institutes of Health, about 30 million men in the US alone deal with ED. That's a small country's worth of people. And globally? The numbers climb even higher as we age, up to 50% of men over 50 experience it to some degree. But here's where I get excited as a doctor: ED isn't a mystery. It's your body waving a flag, saying, hey, something's up. And once we figure out what that something is, we can tackle it together. So, what's causing this? Let's break it down. Alright, let's roll up our sleeves and dig into the science. Don't worry, I'll keep it simple and real. There are 5 major culprits behind ED, and I bet at least one will surprise you. 1. Blood flow issues, the plumbing problem. Think of your body like a high-performance car. For an erection to happen, blood needs to flow into the penis like fuel into an engine. But if your pipes, aka your blood vessels, are clogged or damaged, that flow gets blocked. Conditions like high blood pressure, high cholesterol, or diabetes can gum up the works. In fact, studies show that 70% of men with ED have some kind of cardiovascular issue. Scary, right? But also empowering, because fixing your heart health can fix ED, too. 2. Hormones out of whack. Testosterone isn't just about muscles and deep voices, it's the spark that fuels your sex drive and performance. Low testosterone affects about 1 in 4 men over 30, according to the American Urological Association. Stress, poor sleep, or even too much belly fat can tank those levels. But don't panic, we'll talk about how to boost it naturally in a bit. 3. Nerve signals gone rogue. Your brain and penis need to chat constantly for things to work. Conditions like multiple sclerosis, Parkinson's, or even a back injury can mess up those signals. Diabetes, again, is a big player here. Up to 50% of men with diabetes experience ED because of nerve damage. 4. The mind game, stress and anxiety. Here's the one that sneaks up on people. Performance anxiety, depression, or chronic stress can short-circuit your arousal before it even starts. A 2021 study found that 20% of ED cases in younger men are purely psychological. Your mind is powerful, let's harness it for good, not sabotage. 5. Lifestyle sabotage. Smoking, heavy drinking, or sitting on the couch all day? These habits are like kryptonite to your manhood. Smoking alone doubles your risk of ED by damaging blood vessels, yikes. But here's the flip side: quitting can reverse that damage over time. So, which of these resonates with you? Drop a quick 1, 2, 3, 4, or 5 in the comments. I'm curious what you're thinking. Now, here's where the magic happens. You don't have to live with ED, you can fight back, and I'm here to cheer you on every step of the way. Let's talk solutions, from quick wins to long-term game changers. Step 1. Move your body. Exercise is your secret weapon. A 2018 Harvard study found that just 30 minutes of brisk walking a day cuts ED risk by 40%. Why? It boosts blood flow, ramps up testosterone, and melts stress. Start small, walk around the block, dance in your kitchen, whatever gets you moving. You've got this. Step 2. Eat like a champion. Food isn't just fuel, it's medicine. Ditch the processed junk and load up on ED-fighting superstars, leafy greens, berries, nuts, and fatty fish like salmon. These foods are packed with nitrates and antioxidants that open up blood vessels. Fun fact, the Mediterranean diet slashes ED risk by 30%, per a 2020 study. Who knew spinach could be sexy? Step 3. Sleep like it's your job. Poor sleep tanks testosterone and spikes stress hormones. Aim for 7 to 8 hours a night. A 2019 study showed men who slept better had 50% less ED trouble. Turn off the phone, dim the lights, and make sleep your superpower. Step 4. Stress less, live more. Meditation, deep breathing, or even a good laugh can calm your mind and reboot your system. Try this. Breathe in for 4 seconds, hold for 4, out for 4. Do it now. Feel that shift? Small steps, big wins. Step 5. Check in with your doc. If lifestyle tweaks aren't enough, don't be shy, talk to a doctor. Blood tests can spot low testosterone or hidden health issues. Medications like Viagra work for 70% of men, but I love helping patients fix the root cause, not just the symptom. What's one change you're ready to make today? Tell me in the comments, I'm rooting for you. Section 4. Busting myths and boosting confidence. Before we wrap up, let's squash some myths. ED doesn't mean you're less of a man, it's a health issue, not a character flaw. And no, it's not just an old guy problem, 20% of men under 40 deal with it, too. You're not alone, and you're not broken. This is your chance to take control and feel proud of your body again. What's one myth about ED you've heard that drives you nuts? Share it below, let's debunk it together. Alright, my friends, we've covered a lot today: ED's causes, from blood flow to stress, and how to fight back with simple, powerful steps. You're not just a passenger in this journey, you're the driver. Start small, stay consistent, and watch your confidence soar. I'm Dr. Anna Schneider, and I'm so proud of you for showing up today. Now, I want to hear from you. What's one takeaway you're walking away with? And where are you tuning in from? Chicago? Sydney? Somewhere sunny? Drop it in the comments, hit that like button if this resonated, and subscribe for more no BS health tips. Let's keep this conversation going. Together, we're unstoppable. See you next time.